I'm going to be putting on my personal protective equipment. I'm going to be going into a patient's room that has MRSA, and so that does require isolation precautions. And after I go into the room, I will be setting up a sterile field. But first, before doing that, I'm going to apply my personal protective equipment outside of the room. I'm just going to check the package, make sure there's no tears or that it hasn't been messed with. Everything looks okay, so I'm going to go ahead and open it. And this is just the instructions on what to do, how to put on personal protective equipment, so I'll lay that off to the side. First, I'm going to start with putting on the cap. And when putting this on, I want to make sure that all of the hair is inside. Next, I'm going to go ahead and put on the face mask. And there's, with the top and the bottom, you can tell which one's the top because there's a metal wire, so that way you can form it to fit the way you want around your nose. And there's two strings. I'm going to go ahead and tie the ones around the top first. And then there's these ones that I'll tie around the bottom. Next, I'm going to go ahead and apply the footwear, just so that way when I put on the gown, I won't have to bend over with that on to put them on. And if I had eyewear or goggles, I would put those on as well, but I don't, so I'm not going to worry about that. Next, I'm going to go ahead and put on my gown. And there's strings to tie around the neck and around the waist, so I'm going to go ahead and tie those. And before putting on my gloves, I'm going to go ahead and do my hand hygiene before putting those on. So I want to make sure I just rub it around my hand, through the fingers. And I don't want to put on my gloves until the hand hygiene, the gel has completely dried, which it is. So now I'm going to go ahead and put on my gloves. And I want to make sure when I pull the gloves up, I pull them over the cuffs. So that is how you put on your personal protective equipment. And now it is safe for me to go into my room to prepare my sterile field. So I'm going to go ahead and knock before going in. Knock, knock, knock. And so when I've entered, if there was any visitors in with the patient, I would ask them to leave, and which they have. So now I'm okay to start with my sterile field. I gathered all my items before coming in here. And so first I'm going to start with the sterile field. I just want to check the package, make sure there's no tears, because if there was, it would be contaminated and I wouldn't be able to use it. I want to check the expiration date, which is 3rd month of 2017, so it's fine. So I'm just going to go ahead and peel the package open. And I no longer need this, so I'm just going to go ahead and throw it away. Hope it makes it easy. And this is just the instructions. I don't need that either, so I'm just going to dispose of that. Now I have it set to where it is in the correct position with the flap opening away first. You always want that because you don't want to do that last, because then you will contaminate your field. So I just am going to grab this and pull it away and kind of give it a little tug so that way it won't pop up at me. Next I have the right and left flap. It doesn't matter which order I open that. So I'm just going to go ahead and take this side, and the outer 1 inch is not considered sterile, so it's okay if I touch that area. I'm going to go ahead and do the other side. And now with the way this is set up, it's kind of tricky. You would hope that when you would open one of these that it would be slightly pulled back. So when I open this, I have to be careful where I grab, so that way I'm not touching anything inside the sterile field. So I'm just going to go ahead and grab right here and pull towards me and give it a nice tug. And so now that I have this open, I want to make sure that I'm not just touching anywhere on it or reaching over, because that will contaminate it. And I'll have it at my waist level, because if it was any lower, it would be considered contaminated because it's too close to the floor. But the outer 1 inches are not considered sterile, so I'm going to go ahead and pull it over so that way I have a little bit more workspace. And so next, if I need to open up some of my items to put on here. So I'm going to start with this one. And the outside of the package is not considered sterile. So when I open this, I want to make sure that I'm working and pulling this away so that way it's not contaminating what's inside. And I want to hold it over my sterile field and not too close or not too far away, so that way I can position where I would like it to drop. I'm going to drop it right there. I no longer need this, so I'm just going to go ahead and drop it into the garbage. Next, I have my sterile solution. So first I would take my cup that I'm pouring the solution in and unwrap it out of the sterile package that it's in. So I'm going to go ahead and do that, and I can put this on the sterile field. So I'll put it right on the side so that way I don't have to reach over too far. So here's my sterile solution, and it is brand new. It hasn't been opened yet. The seal's still on. So I'm going to go ahead and twist that off, and when I take the cap off, I don't want to set it with the open spot down. I want to have that up because I'm going to set it off to the side. And so now when I pour the sterile solution, I don't want to pour it too high or too fast, so that way it's not splashing all over the sterile field. So I'll hold that off to the side and just pour how much I need and set it back off to the side. And now I would be ready to start with my sterile field, but first I'm going to take off these gloves that I was working with and perform hand hygiene before putting on my sterile gloves. So I want to pull that inside out and then go underneath. And I would perform my hand hygiene, making sure not to turn my back to the sterile field. So now I have my sterile gloves over here, and I'm going to go ahead and open up the package. And I don't need this wrapper, so I can dispose of that. I'm just going to go ahead and fold this back so that way I'm not dealing with the crease. And it tells me which side is the cuff end, so I want that to be towards me. And since this is all the outside of the wrapper, it's okay if I touch it, just as long as I'm not touching where the glove is right there. And so now I'll do the flap that's further away from me. I'll pull that one back first. And then the one closest to me I'll do now, since I'm just going to do these creases so I don't have to worry about it flopping back up. Now I can go ahead and pull this open. So I want to do my dominant hand first, so I can touch anywhere on the bottom of this cuff. That's where it's folded over. So I'm just going to go ahead and grab that, and I'm able to just slide my hand in. And I'm just touching on the cuff that'll be touching against my hand. And so now with this hand, this one is considered completely sterile, so I don't want to put it below my waist. But to put on my left glove, I'm going to go ahead and cuff underneath the cuff, touching only the side of the glove that'll be on the outside. I'm just going to go ahead and slide my hand in. And so now that I have my sterile gloves on, I'm not going to put my hands below my waist. I'll keep them interlocked like this and above until we are ready to start the procedure. And so now everything is set up and I'm okay to take off everything. But first I'll start with taking off the gloves because that is considered the dirtiest object. So I'm just going to go ahead and grab the inside and pull it inside out. And I'm going to put it inside my other glove. And I'll grab underneath this cuff to pull this one off inside out. And now it doesn't matter which order I take it off, but I'm going to go ahead and take the mask off first. Take off my cap. Next I'll untie the strings of my gown. And then the one around the waist. And when I'm taking this off, I want to be sure that it's falling off of my shoulders first. And then I can grab from the inside and pull down, allowing it to just fall into the garbage. And then I have on the foot covers, and I'll go ahead and take those off and throw those away. And before leaving, I would go ahead and do my hand hygiene again. And that is how you prepare a sterile field, put on your personal protective equipment, and don sterile gloves.